Good afternoon. My name is Tim Markle. I'm director of the Southern Regional Center for Children and Youth with Special Healthcare Needs. I also work with the Youth Health Transition Initiative, which is highly appropriate because today we're going to talk about bridging the gap, about how can we help our kiddos, our young adults, adolescents, young adults that I see as AYA now, and different things that I've been going. That's been the acronym that people have been using is AYA. And so we want to talk about how can we help them transition from pediatric to adult healthcare. So give me a moment and I'm going to share my screen. I see you guys are already using the chat to share, which is fantastic. I believe in multi-connect however and whenever you can. So please continue to utilize the chat as needed. It always just takes me a minute then to rearrange my screens here so I can see everything that I want to see. That's what I'm looking for. There we go. All right. So now I have you guys up and the chat up, so you can also feel free to make notes in the chat if you have questions in the chat or would like to make any comments. But I'm just going to go ahead and I'm just going to start to plow through, because to tell you the truth, this is one of the most often trainings, workshops that I do. So I really enjoy this topic, but I sometimes tend to go too fast. So let me know if I ever need to slow down. So first of all, we know that transition is a huge topic. And so whenever I talk to parents or providers, I want to make sure they understand that this is going to help us to sort of narrow in on what are some specific skills that can be built with youth, with adolescents and young adults, some knowledge that can be learned before they turn 18, but especially also sort of an attitude of self-determination, an attitude of who's going to make the decisions. And I just noticed that I have myself as a presenter, and I guess the last time I did this training, my son Hunter was with me. He's at work because he has a job, which is really, really cool. Very excited for him, but he's not going to be joining us today, so I apologize for that. But let me talk a little bit about who the group that we are a part of is Health Transition Wisconsin. I know some of you already know most of these partners, so I will be relatively quick, but we are funded out of the Department of Health Services through the federal government, what's called a Title V block grant. It may also be called maternal and child health. So they send a grant to each state. The state then determines how to utilize that money that's set aside for maternal child health. 1/3 of that money is set aside for children and youth with special healthcare needs. The state determines how that money gets spent through grants, through their own infrastructure. And so we have a small network in Wisconsin that's funded by the Title V Children and Youth with Special Healthcare Needs block grant. They include Family Voices of Wisconsin, do some fantastic parent advocacy. Parent to Parent Wisconsin is a parent matching organization. Wisconsin Medical Home is working with providers and with families to try to build that partnership of healthcare between the providers and the family, and helping the providers to be accessible, culturally relevant, listening to the family, trying to improve that experience for families, and especially building that partnership, because it works a heck of a lot better when we're working together. ABC for Health is a public health law firm, and they help us when we hit those when we have health benefit questions that are beyond what our information referral specialists know how to handle. They come through and they let us know how we should say stuff, what we should say, and when we should have someone contact them, because it's turned into a legal issue. So they do have lawyers on staff, and they are they're wonderfully knowledgeable. They also have been doing video tips to anytime there's like a change in Medicaid, a change in the insurance world, they'll try to put together like a 3 to 4 minute video that explains the differences and the changes for families. And that's been really helpful as well. Well Badger is a statewide resource center. And then we are Health Transition Wisconsin. The other partner is the 5 regional centers. Wherever you are in Wisconsin, there is a regional center that is there to help you and help your families, to find resources, to find support, to have questions answered, to find out what to do when the IEP is not going well. We are there. We very much believe that when we can all have the information, when we all feel empowered, then change can happen. We try to carry the message of youth health transition is one of our national performance measures, along with building medical home. So who are we? Well, you'll notice that I may use the acronym YETI, Youth Health Transition Initiative. And so I decided that I needed to have something fun in my presentations. And so I pulled out a YETI, which of course my son promptly told me is not a YETI, that it is a Bumble, and Bumbles bounce. And so please forgive me for misnaming the Bumble. But there are a number of Yetis that just find their way into the presentations, because then I see them and it makes me smile. Hopefully it will do the same for you. So what are we talking about when we talk health transition? We are talking about the purpose that we have is to ensure that high quality, developmentally appropriate healthcare services are available in an uninterrupted manner as the person moves from adolescent to adulthood. So just imagine this as this process of transition that realistically we know starts at birth. Is when we think about our children, is we are thinking through their birth about how are we preparing them to be adults, to be the decision makers, to live the life that they want to live, for all our kids, whether they have disabilities or not. And so we look at this time frame, some people between 12 and 18, 14 to 18 in the school system in Wisconsin, they have to start their transition services at 14. So we kind of recommend that the healthcare system moves along in step with the education system. And so we are encouraging families and healthcare providers and other transition partners to begin to include this transition of healthcare into the discussion of transition. So what do we mean by that? Well, what we mean is that if a child has a pediatrician, it's going to be an actual move to a new doctor. But even if the child is in family medicine, they may keep the doctor. But if you remember back to the days when you were a child and what it was like to be a child in the healthcare system versus the adult decision maker in the healthcare system, the visits change, what happens at visits change, who you get to see might change, how you make appointments might change, what you do after hours might change. There's a lot of possibilities. And it can be very individualized depending on who is providing that care for the adolescent young adult. And so it's important to start asking the questions of the healthcare provider early about, well, what's going to happen? What's going to change? This is especially true when the child is maybe complex medical needs. And so there's going to be changes in specialists that may happen. Is that somebody could be really good at tracking and helping somebody with diabetes, but their specialty is pediatric diabetes. And so they're not trained in the adult body and how diabetes looks like in adults. And it does change as we get older. And so we need to set up those specialists that will be on the other side of 18. Again, depending on the clinic, depending on the doctor, that personalization, the specialist and the primary care doctor may not all have this transfer of care, the actual responsibility for that healthcare at the same age. There are some clinics that it's like 18 and you're no longer the child, you're now a young adult. And so you can't come here, or you can't see this doctor, or you can't go to this hospital, depending on the health system. Again, these are things that need to be figured out before the age of 18 happens. Other places, they will continue to see patients up through maybe college. until the child graduates from college. But there's usually some point where they will say, you know what, especially if they're a pediatrician, we need to transfer you over to the adult system. So how do we help support the system to do this? Well, we provide training for healthcare providers, for organizations, about helping them figure out how to embed transition into their medical systems. We have a virtual statewide network and a learning community that we come together and we talk about best practices. We talk about some of the latest stuff that's going on. Usually every year we bring our national partners, Got Transition, and they talk about what are effective ways to code to get transition services paid for, because that's always a major point for doctors' offices. Website, community outreach, workshops such as this, and other resources that we have that are all available on our website. So you think that we were already going, but we're not. So this is a point where I'm supposed to tell you what we're going to talk about. So we're going to talk about what this healthcare transition is, which I've kind of already done, but I really want to show you some tools that you can use, such as a readiness assessment and some of the tools that we think are important for adults and young adults and adolescents to learn before they become their own decision makers. And then I'd love to have a discussion about how to help youth talk about their own healthcare needs and advocate for their own health. One of the things that we see is that we are so good as parents and as a system, we want to support our youth so well that sometimes we forget that part of that supporting is teaching them to make their own decisions and being responsible for those decisions. And that's especially true in the area of health. So let me tell you a little story about Hunter. That's my son there. Normally he would be with me. But that picture is up at Door County. One fun fact about this picture is that we just went back up to Door County. This was probably about 6 years ago, and that rock is now underwater, which is just really bizarre to me. So this is out on a little pier, and you had to step across some stones and some water to get out onto this platform. Hunter's not the biggest fan of wide open water. I'm not really the biggest fan of wide open water. So we wanted to get this picture. We wanted to see if he could do this when he was around 16, 17 years old. But we knew that if we just pushed him out onto the rock, that this was going to be a horrible failure. So we took some time. We walked around the pier a little bit. I went out onto the rock. His sister went out onto the rock as we modeled how to get out onto the rock. And then we let him slowly take his time to be able to get onto the rock. There was a lot of time and energy spent just to get him to this point of the picture. As you could tell, he is smiling, but his eyes are closed and he is holding onto my hand. So he's not totally comfortable out there on the rock, but he made it. And so when we talk about healthcare transition, we think about what are those goals that are going to help our youth succeed when they are adults in the healthcare system. So, I mean, basically what we are talking about is this process of change. And this is something that it's not just in Wisconsin, but other states. We have a national group that is helping the pediatricians, helping the clinics to embed health transition into healthcare, because that's where we think it needs to live. But in the meantime, we also want to prepare families, and we want to prepare our other transition partners to consider healthcare transition as well. So who needs to think about transition? Well, basically anybody turning 18, but especially if a child is identified with a disability or healthcare need, is we have some of our kiddos that continual care is vital to their ongoing health. Is they need to know what hospital they may get admitted to because they have a large number of emergencies. They may have medications that they need to make sure that they take for the sake of their health. There are a lot of important reasons why people with disability or healthcare needs need to have that continuous care. And if you're not prepared either insurance-wise with public benefits, hospitalizations, to have that new place set up, then you may hit that point where there may be an emergency, and it's going to take a while to figure out where exactly you should be going and who should be treating and who's going to be paying for it. And any delays are not necessary, and they're also not healthy for our kiddos. So if you think for a minute about why health matters, the healthier we are, the more we have our independence. Now, none of us are 100% independent. I almost said codependent. I am interdependent. That's another talk. But I am interdependent on a number of people in my life. My father-in-law is a fantastic mechanic. I don't buy a car without checking with him. I bring him along. And there's other areas where there's just people that know more that I utilize to make decisions, help me to make decisions. But the more I understand who I am and who my body is, then the more I can make decisions for myself. And so it increases our independence. A healthy lifestyle leads us to success in day-to-day life. Think about education, think about working. It's hard to succeed in either of those if you can't show up. And sometimes we can't show up because of our health. Sometimes there's nothing we can do about it. But a lot of times, if we're aware of what good feels like in our bodies, we can also become aware of when our bodies start to feel not so good, and try to take care of that before it gets to that edge of emergency where I can't do anything. Also being able to talk to our educators, especially in higher education and in employment, about what are my health needs? Do I need extra water? Do I need to always have water with me? Do I need extra breaks? Being able to explain, when appropriate, our disability, being able to explain what our healthcare needs are. Like to play a little game just to make sure people are still awake. So throw into the chat, what majorly happens in the United States at age 16? And we have driving, and we're going to go with that answer as being a really great answer. Maybe we are, I don't know. Yes, animation works today. How about age 18? What are things that happen when someone's 18? Yes, you officially become an adult. Which means you're able to sign contracts, and voting comes into play. And then at age 21, what happens? What's the big deal in United States about age 21? Yes, drinking. Thank you, Allie. And of course, it's drinking responsibly. And so these are the things that our youth know as sort of their milestones. Well, we wouldn't think about, okay, here you are, 16, here's the keys, have fun. We're going to prepare them how to drive. Hopefully by the time they're 18, we've introduced them to the world of politics, and the first time they're hearing about voting isn't when we drop them off at the polls. Hopefully we have some preparation so they understand the power of the vote, and that this is how your leaders know what you would like them to do. And then drinking responsibly. So in all these areas, we don't want the adolescent's first experience to be at 18. So that's the same with pretty much everything that we have in adulthood, is we're hoping that there is preparation to become adults, to practice some of the skills that you need to succeed as an adult. And so when we think healthcare transition, what we do is we want families and we want the organizations to try to remember to stay a step ahead. What is there that you could do when that adolescent is 12 to 14? What are some things maybe they should be able to do by the time they're 15 or 16? And then by age 18, what are the skills, knowledge, and attitudes that they should have developed so they don't fall off that cliff? So to help in that process, we've come up with 8 tools of transition and also have a readiness assessment. Obviously, I'm not going to be able to go over everything in depth. I'm just going to touch on everything, but you can find all these tools and explanations as well as different readiness assessments on our website at Health Transition Wisconsin. There's a training that we do specifically for families called Build Your Bridge, and the Build Your Bridge workbook is available there as well. And that may be something you may want to look at. When we're talking about these 8 tools, these are the tools that you can start with at a young age and then help build those skills, such as making appointments. I remember when my kids were younger, we would start with having them go up to the desk and tell the person their name. And that was it. Just tell them who you are. Just, no, please go ahead. You can tell them, it's okay. And just helping them to get comfortable with that. Well, as they got older, we would help them figure out, okay, so they're going to ask a certain set of questions. So help them answer, where do you live? What's your date of birth? What's your health insurance number? No, we never made them, memorize. I don't even know my health insurance number, but we tried to prepare them. And then, we noticed a difference between my son with autism and my daughter is that there was a different learning curve that happened. And so we sometimes had to slow things down and break things down so that he would be able to do it. So did he do everything at the same age he did? No, absolutely not. But he grew and we were patient with him in learning how to set the appointments. Now, of course, he has my chart. And so he doesn't have to pick up the friggin' phone, which also works for my daughter, who also doesn't want to pick up the friggin' phone, except to text. So they're loving this. Back in the day, you had to actually talk to people. So they're really happy. They don't have to talk to anybody. They do it all online. They're excited. But one of the things that we talk about is the need to determine who those adult providers are going to be. So who are the specialists, who's the main care, get that set up before 18. We encourage people to talk to other parents, talk to their current doctors about it, call their healthcare system and say, hey, who's available, who specializes in this, and try to get those things set up, because ideally you're going to be able to have choices. It doesn't happen everywhere, but ideally you might have choices where you can talk to different providers and try to figure out who's going to be the best fit for your child, where that adolescent can figure out who's going to be the best fit for them. That's an ideal world. In some places, you don't have many options. It's the closest clinic that takes your insurance. And so setting up, having them getting to know you is still important, but you're not going to have those options to say, wow, I really just don't like this person. And so there's going to be a little bit more give and take, unfortunately. One of the most important things we talk about with families is who's going to make those medical decisions when the child turns 18. Who is the appropriate decision maker? I would love it if every child was able to turn 18 and they're just, boom, ready to make every decision in the world. The reality was I probably was not. Okay, reality was I was not ready to make every decision in the world when I turned 18. I made some really crappy choices, 18, 19, 20, 21, 43 years old, just some really bad choices along the way. So we know that our kids are not going to make all the right choices all the time, whether they have a disability special health care need or not. So we want to provide a supportive environment where they are as safe as they possibly can be, so they are not taken advantage of, so that they can remain healthy and as independent as possible. So sometimes that means that parents will have guardianship, that they have determined that their child is not going to make good decisions, healthy decisions. They just don't have the capacity. They're going to get taken advantage of. And so the parents want to retain that right of decision-making. They want to take those rights away from their child and retain them for themselves. There are also cases where you can have specific areas using power of attorneys to have specific power to make decisions in healthcare, or power to make decisions over the financial part. So not full guardianship, but you have the power in certain decision-making. There's also tools that are out there now that we do trainings on called supported decision-making, where the person retains their right to make those decisions, but they've identified people that they want with them to help explain and to help communicate the decisions, either understanding what is being asked of them or helping to translate their wishes and what they're saying to the other party. And so I would encourage you, just keep checking out our stuff. We'll have some more supported decision-making workshops through Board of People with Developmental Disabilities and through Family Voices of Wisconsin coming up in 2023. We need to be aware of what health insurances may change at 18 and then especially at 26. Right now, children are allowed to be on their parents' insurance until age 26. You can also, depending on your insurance company, depending on your child, talk to your insurance company about continued coverage if that child has a disability past 26. And so it's not always as cut and dry as it sounds. Knowing where emergency contacts are, we encourage a lot, and there's instructions on our website about how to get them into your cell phone. So that, because what we're seeing, what we know is that a lot of kids are carrying around their cell phone a lot more than they're carrying around a wallet. And so we want to make sure that those emergency contacts are in that cell phone. Learning about what medications and what they do are really important. A lot of times we get used to just, please, here you go, here's your morning meds, here's your afternoon meds. And we sometimes don't stop to slow down and think, oh, they probably need to know why. What is this supposed to do, so that you know when it's not working, so you know when it is working. Medications also covers about, how do you refill your medications? I went away to college and my medication fairy did not follow me. And so when my medicine ran out, I was like, what the hell? I go to the cabinet and it's an empty bottle. Well, that's probably the first time in 18 years that I've ever had an empty bottle of medicine in my medicine cabinet, because my mom always took care of these things. So it's important to help teach how to do that. A health summary, understanding about, what are the major parts about my health, and then about me is basically talking about, these are my preferences. This is what I like. These are my goals. Healthcare should be part of us reaching our goals of it having the best life possible. And so we want our kids to understand that it's not just, we want them to be able to talk to the doctors as a person and not just as a chart, and not just as a diagnosis, that they understand that they are a person. A lot of these tools are already in what's called the readiness assessment. This is a copy of the readiness assessment from Got Transition. They have a number of different forms. They have it available in Spanish. They have some available for education purposes, but there's other places that have transition readiness assessments as well. But this is the opportunity to actually have a point in time, like 12 years old, where you go through a list and you determine, okay, these are some of the skills that you need to do to make those decisions as an adult. What do you already know? What do you maybe have to work on? Where should we spend our time learning? And then maybe what are some things, depending on complexity of a child's medical condition, there may be some things that they're not going to do, that's just not applicable to them. All right, well then let's not spend time on those. Let's spend the time on teaching the things that they have accessible, that they can somehow know to do. So you'll notice we already talked about most everything on this transition readiness assessment, but you can feel free to go ahead and check out your own. They do a wonderful job of making them, you can put your own logo on them as long as they have this little thing on the bottom, but you can choose the questions that you think are applicable on there. They're very great word usage. They're very something. They are very, flexible. Anyway, that's what they are. So by now, I hope you would be able to tell me how you would find healthcare and healthcare transition to be helpful in a variety of settings. Obviously in healthcare management, in employment, understanding how to talk about my health conditions, in independent living, understanding where I can live. If I move away from my family, am I moving out of my network? What is this in-network, out-of-network stuff? Words that we learn as adults: in-network, out-of-network, copay, deductibles. Usually we don't hear about these until we're an adult. So let's start teaching them this language so they're prepared as an adult. How am I going to get my healthcare in a post-secondary setting? Who do I need to tell when I go away to school about my health condition? Do I need to tell anybody? Is anybody going to be checking up on me? The answer is no. No one usually will be checking up on you in higher education. And the person responsible for you letting people know is you. You take responsibility for letting them know about what accommodations you might need, about what emergencies may come up. It is totally the responsibility of the youth heading off to college to do that. In schools, they have something called the post-secondary transition plan. Now we're going to talk about that in a moment, along with self-advocacy. In the state of Wisconsin, is the Transition Improvement Grant has an app for the post-secondary transition plan where anybody can go in, and you have to finish it in one setting. You go back and do it again, but your stuff is not going to be there. But it's a step-by-step walkthrough about what age are you, what are your goals, what do you think you might want to do, what are things that you think you might want to work on. It actually is setting up that plan for what is going to happen after high school. We are encouraging them and trying to work with them about considering where inside that post-secondary transition plan could healthcare be part of what they work on while they're in high school. Is it in making appointments? Is it understanding about my health condition? Is it being able to communicate about my health condition, be able to communicate what my needs are? Is it about being able to make my own decisions and not just saying whatever, but that they are in charge of their bodies and that they are in charge of their health care? And so we encourage them to make that a part of the post-secondary transition plan. And Tracy, you're not alone. You're just so not alone. When I do this training for like our graduate students and our trainees, you can see them taking notes about what they're supposed to be doing at 21 years old. They're like, oh, I've never filled a prescription before in my life. That's true. And so these are, I mean, healthcare transitions like that happens for all people, but we don't think about it. It's just not part of the transition conversation. And so that's what we're trying to do, is get it to be part of the transition conversation. We definitely think that within the post-secondary transition planning should be an emphasis on self-advocacy, that by the time our kids, if they have an individualized education plan, an IEP, that by high school, to the extent possible, they are leading those IEP meetings, that they are doing what's called self-directed IEPs, that they are the ones that we are placing them in the driver's seat about what are their needs, communicating what their needs are, communicating what helps them, communicating what they need to learn based on the goals that they have set. It's a little harder that way, but it's the way that IEP should be done when you get into high school. And again, sometimes it depends on the child's level of care and level of complexity. But we very much see that anything you can do to build self-advocacy in high school is going to help in that medical transition-making process as well. Just wanted to go over a brief timeline to show you where this all fits together. So you can see that at age 14 in Wisconsin, the post-secondary transition plan, every student who has an individualized education plan, every student in special education is also supposed to be having a post-secondary transition plan. That's what the state of Wisconsin says. If they have public benefits, they want to be in touch with their local Aging and Disability Resource Center. This is to work on that transition from children's long-term support into the adult long-term support network. The transition from childhood SSI to adult SSI, the transition from Medicaid and do, how do I keep my Medicaid as an adult? There is always new tests that have to be done, new screening that gets done. Is very few things, like I can't think of any, that are just automatic. There's action that has to be taken. The Aging Disability Resource Center can help in that area of public benefits to make sure that you're set up as best you can before that transition. The bad news is not everything transitions at the same time. So like, depending on the form of Medicaid you have, it ends 18 or 19, or so you really need to talk to them about your specific case. Before 18, you really should have a decision about, is the guardianship the best option for your child? Remember that guardianship is also very hard to reverse, that it is taking away somebody's rights, and it's hard to restore those rights. Basically, the court is declaring this person to be incapable and incompetent. And so then it's really hard to go back and show what has changed to then make somebody competent. So guardianship is hard to reverse. It is possible, but we encourage, depending on the situation, to start with some of those least restrictive forms of decision-making. So try supported decision-making first. Yes, Allie.
I was just curious, so do you have to determine guardianship before 18, or if you don't do anything about it, can you wait till they're like 21? You're like, you know what, I think it'd be better if we added this.
Absolutely. You don't have to at 18, but if you don't, you lose your power of decision-making, so to speak, as a parent, is they are then responsible. Now, are you just going to cut off support and say, well, dude, I'm not your guardian, so, screw you, you're on your own? No, of course not. We're going to be there supporting them along the way. And hopefully we build up this relationship with them where they trust us and we can make these decisions together, where we can empower them to make the decisions. So no, at any point in someone's life, if they are becoming a danger to themselves, a danger to others, they may be placed under guardianship, or you could ask for guardianship. So no, it doesn't. If you don't do it at 18, and then at 21, you're like, this is a friggin' mess. He's signing contracts. He's getting in all sorts of trouble. Yeah, you may want to consider then guardianship at a later age.
Thank you.
Yes, Tracy.
So let's just say that there is a whole bunch of mistakes that they're making at that age. Would putting them in guardianship prior to that kind of protect them from those? No. It will
limit their choices. Okay, so like, they shouldn't be allowed to enter into contracts. They won't be allowed to vote. But if they break the law doesn't care. The law still sees them as 18. So it will protect them from some civil cases. Like they shouldn't be allowed to buy stuff, especially cars, houses, those sort of things. So it's protective in that sort of way, but it doesn't stop us from being stupid. And so it's hard, and it's a very personal decision. And I would definitely, we're hoping in January to have Barbara Katzen to talk about more about supported decision-making. She is far more an expert on it than I am. That's my way to stop talking about it.
Thank you.
Absolutely. At this point, no matter whether you have a disability or not, if you're a male, you need to register for selective service. Sometimes parents forget about that. SSI, like I said, SSI changes, and who makes the decisions will change. Briefly, what we recommend for healthcare is that clinics and families begin talking with their adolescent young adult about age 12, about eventually they're going to be an adult, and that things will be changing, that they start some formal planning at age 14, working on, maybe identifying those adult providers, but especially working on the stuff like making appointments, of setting up how to do the medications. And then at age 16, just building upon what you learned at 14. getting ready again, building those decision-making, building that self-advocacy skills. And then hopefully around 18, being able to have a visit with the new provider as well as the adolescent provider. So there could be a formal handoff, but at some point there's going to be what's called a transition of care, where this doctor is no longer the primary care doctor, somebody else is the primary care doctor, is the care itself has been transferred. And that depends on the system. Again, you're going to want to talk to your system about that. So what have parents told us? Parents have told us, make a plan. Don't be surprised at 18. Don't let it sneak up on you. Record everything. Consider keeping a care notebook, some sort of notebook that lets you know who you talk to, how's that working into transition. Breaking things into smaller tasks. Like there's so much in the area of transition that breaking it down in those smaller pieces is really important. Don't be surprised as the system works, as Allie is figuring out. If the system takes a little longer than you expect it to, what makes sense to us does not always make sense to bureaucracies. And so don't be surprised if things take longer. Plan ahead. Ask questions about people involved in your child's life. Ask questions of the nurse when you go see them in healthcare. How is this going to change when my kid turns 18? And spend some time trying to get to know other parents who are having a similar experience. Sometimes parents in high school will get together every so often and just talk transition because they're the ones that are understanding it. The rest of the world is just, they're like on this automatic thing. And with our kids, we just really have to think about these things. So what are some next steps? Go ahead and download that readiness assessment. Start talking about, what is this going to look like when you're 18? Look at the website, look at the workbook, ask your IEP team to consider healthcare as one of the goals in their IEP planning. Talk to your primary care doctor or specialist. Go ahead and find out where your ADRC is. Some ADRCs will talk to parents before their child is 17 and a half, just to inform them about what the process is, but they can't really start any of the actual formal legal processes before 17 and a half. So like setting up for a new screening for the adult long-term care system. So some places will talk before that. Some places will ask you to call back at 17 and a half. No matter what, take a deep breath. Know that families across the world have done this successfully. This is something you can do. It's something we can grow in our knowledge. We can grow our skills and we can control our attitudes about. But we really do want to try to stay a step ahead. I will send you these slides after we're done and after I get the recording done. But there's a link to Got Transition, which has a ton of resources on there for physicians, but also for families. Health Transition Wisconsin is our website. The Pacer Center is in Minnesota. They have been doing transition stuff for years. And I regularly pull stuff and put it into the weekly resource roundup from the Pacer Center. So they have some excellent ideas out there for families and helpful hints for families. WISE Wisconsin is a program that is about stigma reduction. They have a program called Up to Me, which helps people talk about my health issues, that helps people talk about who do I tell and when do I tell? How can I be in charge of who knows these intimate details about me? Because up until 18, our kids pretty much get used to us talking about them. Somewhere in those adolescent years, they get kind of tired of it and they want to control who knows what about them. The Up to Me training can help them figure out how to do that. We also work with a great group called Patch, Providers and Teams, Communicating for Health. They help train physicians and they help train other youth about the rights and responsibilities of adolescents. Board of People with Developmental Disabilities has self-directed healthcare kit that I really, really love. And I really liked these people so much that I just, did animation. And so you get to see them for a while longer than any other slide. If you need to reach out to me, this is the way you can contact me. On behalf of the Yeti, thank you so much, or Bumble, if you prefer. Thank you so much. I would now love to stop sharing and I did not leave as much time as I wanted to for discussions. Like I said, I just talk about this stuff so much. I love it. But what other questions or thoughts do you have? As a matter of fact, hang on one second. I'm going to stop the recording.